If you're a dentist, you're making good money, people start to question your ethics for some reason. If you're focused on being a more productive provider, they label you as being greedy. I'm about to tell you why this is complete BS and why the most productive dentists are the ones that are actually providing their patients with the best overall experience, and the ones who are not just trustworthy, but have created a brand that people admire, trust, and respect. So I think it's kind of this oxymoron. They say more productive, that you're more unethical, when I would argue that, especially the doctors that are productive over a long span of time are usually the ones that have the best reputations. I personally get comments all the time. Are you making that money ethically? Why are you always talking about production and money? It's kind of taboo within our profession, which I think needs to change. And you see it all over social media. Dentists complaining that the profession isn't worth it anymore, that you can't make money without compromising your ethics, that if you want to be a good dentist, you have to accept almost being broke. When I'd argue that if you're a broke dentist and you're worried about money and paying bills, those are the ones that are going to be more likely to do something that's unethical. Me personally, I don't like to worry about money. I like to have an abundant mentality. I like to provide my patients the best value, the best care. If I have to redo something, I'll do it. I don't charge for, small things. I go above and beyond. So this narrative isn't just wrong, it's also dangerous, and it's keeping good dentists from reaching their full potential, and also just making people not get into profession at all who may have been wanting to. So here's what nobody wants to admit. The most productive dentists, especially over a consistent time period, like I just said, are the ones who have a great reputation amongst patients, right? They are the ones who patients are referring their family members to, right? And also ones who just understand everything outside of the clinical part of dentistry itself. See, it took me years to even want to create content about dentistry. You know why? Because I was afraid of this exactly, right? I know that it's taboo in our profession to talk about these things, and people I know are going to question my motives. But I realized something. There are too many creators out there who are better at social media and creating content than they actually are being providers or healthcare providers. A lot of the spokespeople within our profession who maybe didn't have success doing clinical dentistry, and they veered off and they started to do content and teach people how to do clear aligners, and now they consult for DSOs, and they really never were able to have success as general dentists and grow a practice and grow a following. And this is something that I noticed, and I've invested personally thousands of dollars into coaching, into understanding the business side. And a lot of the things that I've done to become more productive have nothing to do with the clinical aspect of dentistry itself. 90% of the things that I've done to go from making 150 or producing, under $1 million to producing, over 1.5 million in gross production. That's not take home, by the way, guys. I'm an associate. But the thing that made me jump up was understanding everything around the office except my role. Like, it wasn't me treatment planning more things or being more aggressive or being unethical, forcing treatment down patients' throats that they don't need. No, it was understanding clinical operations, how to lead an office, how to find the bottlenecks in my office. And once I did that, it was just, the rest was history, right? The ones that are also more productive are also doctors that are willing to provide same-day treatment, right? I go above and beyond, and I find patients room in the schedule if I can do treatment. If someone has pain and they come in and my schedule's filled, I'm willing to see that patient and at least give them an antibiotic, create a treatment plan. And a lot of the dentists you guys follow that talk down on the profession or who aren't having success, who are second guessing this profession overall, are people that aren't honestly just going above and beyond for their patients. It's just that simple. And really, productive dentists, what they really do is invest in themselves and in their skills so that they're better for their patients, right? I've invested in not just learning more procedures, but also the soft skills that are needed to effectively communicate to patients, because there's a large part of being a dentist that is an art, not a science. And the thing is, all of us dentists are science people. We got into the profession because we love science, right? We've taken so many classes and we're used to having a science-based approach to what we do. However, in the real world, it's an art form. And now it's an art form that some are just more naturally, good with. Some of those who maybe had experience in like a customer service profession or, working at restaurants or anything dealing with people. But this is something that you can learn and you can perfect. And that's pretty much the basis of why I've even created this channel, to just put that out there. And I've helped a lot of new dentists kind of sharpen their skills and find their own style that works for them. But it's really an art form, making everything work, leading, right? Being a professional, how to basically create win-win situations for everybody involved, for your assistants, for your front desk, for your patients, putting yourself last, right? See, your ethics aren't going to be compromised when you're having success. It's going to be compromised when you aren't doing well. In fact, a lot of the unethical treatment or things that I've seen in our industry are from doctors who either aren't doing well or they got into practice ownership without understanding the business elements of it, start to have serious financial problems. And these are the people that you see that are treatment planning composites, on incipient lesions that have been the same size for over 5 years, or they're trying to push a patient to do an implant, or they're doing whatever they can to just keep the lights on, right? Like, when you have success and you are coming from a place of abundance and you're doing well, all you do is try to do what's best for your patient and the money comes. So stop buying into this narrative and start investing into yourself. Start figuring out what is it you're doing wrong. Consult a coach, a mentor, someone who is actually having success, and that's it, right? Money should not be your goal. Your goal should be providing the best care and making the most of your time and your patient's time. And if you're able to do that, that's when you will have monetary success. So as you can see, if you do the right thing, you will be more productive versus the opposite of what everyone else is telling you. So if any of this interests you, if you would like to learn more about the things that I learned myself to become more productive, just click the link in my bio, join my free school community. The first 100 members, I am giving you guys a 1-hour free phone call to just answer any questions that you may have. Anything that I could help you with, I will. If I don't know the answer, I will try my best to guide you to someone who does. So thanks for watching. Let me know if you guys want to see any other videos. Let me know what you want to see, what you like, what you don't like, and I'll see you guys in the next one. Peace.